Did you know that 2.3 billion people will be needing care by 2030? That is according to the International Labour Organization ILO report. Welcome to your #1 labor program from Africa to the world, the Tripartite, the Worker, Employer, and Government Roundtable. I am your regular host, Abulu Osemahu. Thanks for joining us. Now, in our Let's Talk segment, we will reveal to you that apart from doctors and nurses that you are familiar with in the hospitals, there are over 25 other health workers and allied health professionals. We have the national chairman of the Joint Health Sector Unions, Ado Kabiru, in our Let's Talk segment to bring us up to speed with those numbers and some very important information about why they also are agitating to down tools. You remember last week we told you about the nurses and government intervened, and now we have these health workers, so many of them also having one or two demands. In our Let's Talk segment, we will handle that. But before all that, let's welcome Francis Okoliko to bring us up to speed with labor stories shaping the world of work globally.
Hello and thanks for joining us on this segment where we bring you trending global labor stories shaping the world of work and promoting retirees' welfare. Let's begin this way. You remember we brought you a story of retired policemen in Nigeria protesting and demanding to be removed from the contributory pension scheme over the delay in the release of their pensions and other benefits. This week, however, we have cheering news, as the country's President Bola Tinubu has directed the expedited rollout of the Free Healthcare Access Initiative for low-income retirees under the Contributory Pension Scheme, describing it as a critical component of social protection and dignity in retirement. A statement signed by presidential spokesman Bayo Onanuga said the president also called for the prompt implementation of long overdue pension increases and a minimum pension guarantee which would provide a safety net for the most vulnerable pensioners under the contributory pension scheme. The statement mandated the Pensions Commission to urgently resolve the long-standing police pension issue, emphasizing that members of the police force who serve and protect the nation deserve to retire with dignity and peace of mind. Pensioners in Nigeria appear to be getting fully packed love from the country's president as the proposed reform features a new pension rate of 32,000 naira, along with incremental increases of 10.66% and 12.95% for pensioners from defunct and privatized agencies. Additional measures include harmonizing pension rates for all defined benefit scheme pensioners and enrolling them in the National Health Insurance Scheme. The Tripartite learned that this exciting news includes a presidential directive which also covered outstanding payments owed to NITEL and MTEL pensioners and other retirees from defunct parastatals incorporated into the 2026 budget proposal. In a twist on Monday, August 11th, retired federal pensioners in some cities in Nigeria took to the streets again, demanding payment of several months' pension arrears and payment of 32,000 naira minimum pensions. What's the update on the national living wage estimate in the UK? Now, the Low Pay Commission has updated its projections for the national living wage in 2026. The UK government has on August 5th published the Low Pay Commission's remit for the rates of the national minimum wage and national living wage that will apply from April 2026. Did you know that by 2030, 2.3 billion people will need care? That is 200 million more than 2015. According to the International Labour Organization, ILO, the care economy encompasses economic activities related to physical, emotional, and psychological care, promoting gender-inclusive growth and recognizing the value of unpaid care work. This sector is vital for sustainable development, human well-being, and economic growth, with estimates suggesting that unpaid care work would represent 9% of global GDP if compensated. Did you also know that investing in care infrastructure can create jobs, prevent occupational downgrading, and increase the female labor force participation? According to research, a $1.3 trillion investment in social jobs like care economy could yield a $3.1 trillion GDP return and create over 10 million jobs in the US. The care economy includes both paid and unpaid care such as childcare, elder care, and healthcare services, as well as indirect care like cooking and cleaning. At Tripartite TV, we believe governments can foster a caring economy by investing in quality care provision, social services, and social protection. This includes implementing policies like parental leave, flexible work arrangements, and affordable childcare. But is this the case? The International Trade Union Confederation, ituc-Africa Regional Office, in a statement by its General Secretary, Joel Ahato, has joined organized labor in Nigeria in calling the government for caution regarding a recently approved National Industrial Relations Policy, describing it as an instrument prepared to suppress workers' voices and criminalize strike against ILO Convention 87, which was adopted in 1948. But Nigeria's Minister of Labor and Employment, Mohammed Dingyadi, has countered organized labor's fears, insisting that the new policy is aimed at creating a more harmonious working environment among workers, employers, and governments, which is a tripartite. And that's all labor stories shaping the world of work this week. Thanks for investing your time with us on this segment. I am Francis.
My name is Mohammed Gadi, the Minister of Labor and Employment. You are watching the Tripartite program on AIT.
Last week we brought you stories about how the strike by nurses crippled hospitals across Nigeria until there was an intervention by the Minister of Health and the Minister of Labor in Nigeria. But we understand there are some other health workers who are agitating for their demands to be met. Yes. So you are welcome to the Tripartite labor program centered on workers, employers, and government issues. Today we are focusing on the health sector, what we did last week, and we are driving it now. Just quickly tell us, what is this JOHESU and APA? Who are the unions in these two bodies?
Well, JOHESU and AFA is a combination of presently 4 affiliate health workers union. Initially, we were together with nurses and midwives, but they opted out that make us 4. But initially we are 5. And the 4 comprises of Medical and Health Workers Union of Nigeria, NASU, Non-Academic Staff Union, we have South Tri, which is Senior Staff Association, and then we have NUAP. These are the 4 affiliates of the Joint Health Sector Union. And this Joint Health Sector Union covers more than 80% of the total health workforce in the country. So the AFA is the technical arm of JOHESU, which also comprises of another group of health workers. So this together we came and formed what we refer to as Joint Health Sector Union. And all these affiliates of JOHESU are also affiliated to the two labor centers in the country, the Nigerian Labor Congress and Trade Union Congress.
Okay, now you said your members constitute about 80%, but most patients know doctors and nurses. Who are these your members? And if they are not in the hospital, how will it affect patients, which is the primary objective of the hospital?
Well, health service delivery is a teamwork, and every health worker is important. And I believe majority of the health workers, as I rightly said, more than 80% are from these four affiliated unions. Like in medical and health workers in Nigeria, we have about 17 professional associations under it. And these associations include the Pharmacy Technician Association, Laboratory Technician, Dental Technician, Community Health, Environmental Health, and so on. And then under the NUAF also, we have the pharmacists who are in charge of pharmacy department. We have the laboratory scientists who are in charge of laboratories. We have the physiotherapists, and a lot of them. So under the medical and health workers in Nigeria, as I said, we have 17 professional associations. We have even the mortuary attendants. We have the ambulance drivers. These are all category of workers that are under the Joint Health Sector Union.
Wow, this is a large number. So the accountant,
yes,
part of it.
Even the administrative staff, the accountant, and the admin
secretaries,
staff, secretaries, they are all members of medical and members of JOHESU.
So if you go on strike today, the nurses and doctors will not be able to function?
Well, as I said earlier, that health team service delivery is a teamwork. No one can do without another. But I believe we have the large number that when we go on strike, we cripple the hospital.
Wow. And most people don't want health workers to go on strike. So let me quickly go to your welfare now. Yeah. We understand that the nurses that went on strike last time were agitating over a circular released by the National Salaries, Incomes and Wages Commission. And did that also affect your members? Because we understand you have agitation as well.
Yes, we have agitation.
What really is the circular saying, and how did it affect your members?
The circular is a review of relativity or some allowances that were for health workers. And this circular affects the two salary structures in the health system. In the health system, we have the CONHES salary and the COMES salary. The COMES salary is mainly for doctors only, while the CONHES salary structure is for other healthcare professionals, including our members and that of nurses. But there is an upward review which the Nigerian Medical Association thought it does not favor them. So they now threaten government with ultimatum to go on strike on that circular. And along the line, the government decided to withdraw the circular, and still consultation is ongoing. But our own area of concern is that this circular does not only affect CONHES, COMES. It affects both CONHES and COMES. So how can somebody come and shave your head in your absence? I think it's not justifiable. So we also, as stakeholders, we have raised alarm, though we have not given ultimatum, but we are still on consultation, and there is ongoing discussion with the government on the issue and other relevant issues.
Tell us categorically how did the issue affect CONHES? CONHES is Consolidated Health Salary Structure, where JOHESU falls. Is it that they reduce your salary, they reduce your allowance? Like the nurses, so many issues they talked about, the issue of uniform allowance and what have you. What exactly did the circular from Salaries and Income Wages Commission say regarding CONHES?
No, it's not a matter of reduction of salary. Like in our own observation in the circular, we have some of our members that also deserve the issue of uniform allowance and other allowances that were not captured in the circular. And at the same time, since the inception of the two circulars, the COMES and the CONHET, in our own collective bargaining agreement, it says once one circular is tinkered, it automatically reflects tinkering of the other one. So obviously there is what is called relativity ratio, which was taken care during the first circular between the two different salary structures. So once one ratio is tinkered, then the other one has to be tinkered. So I think the NMS agitation is that the ratio that they use in upward review of that circular, they are not satisfied with it. And even ourselves also, because even if there is going to be any increase on the ratio, then it has to reflect from the basis what was started since the implementation of the circular.
Okay, fine. Nigerians, Africans, and the global community want to hear that there is a development. But quickly tell us through those 10 items you mentioned. We understand you have issue of age in it for consultant pharmacists, and what other issues? Tell me, what are those 10 issues that is bothering JOHESU that if government does not agree, resolve, it can lead it to down to?
Well, there were some issues that we resolved with a timeline. And there are some issues that we are still discussing on it. Like, as I said earlier, JOHESU has been patient and looking at the kind of our work, we always decided to take strike action as our last option. So the first issue is CONHES adjustment. As I said earlier, in the collective bargaining agreement of 2nd December 2009, it was agreed between JOHESU and federal government that tinkering of one salary structure will automatically tinker the other. So in 2004, there was adjustment. 2014, there is adjustment of COMES salary. And that adjustment was not done to CONHES. So this adjustment struggle is on for the last 11 or 12 years on JOHESU, which I think there's no justice in that. So this is the first flagship demand of JOHESU, which is under the Presidential Committee on Salaries, that that committee, that issue has to go through that committee, and we are still on it. Then the second issue is the issue of the circular, withdrawal of the circular that you are talking about, because we agitated that without hearing from us, without hearing from our grievances, government should not just automatically withdraw the circular because of agitation of one party. So we also raised our case, and that is our second issue. And then the third issue is more or less a general issue, because it's a 7-month arrears of CONHES and COMES salary structures. There are arrears upward review of these two salary structures sometimes few years ago. And after implementation, we still have 7-month arrears that was not paid. And that arrears cut across both COMES and CONHES. So we are still agitating on it. Although the federal government recent resolution said it will be paid on or before the end of this August. So we pray that that should be paid. Then the fourth one is the issue of internship centralization for our membership in the under JOHESU in federal health facilities. Then number 5 is the issue of the upward review of the retirement age that you are talking about. This issue has been on for long. And as part of our ongoing discussion with the Federal Ministry of Health and the Federal Ministry of Labor, we suggested as JOHESU that since this issue has gone through National Council of Establishment 3 times without scaling through, and it's very important to us because of the brain drain in the health sector. So we propose that the Federal Ministry of Health should take up that issue to Federal Executive Council for ratification. And then when it was taken to the Federal Executive Council, it was approved by the President and the FEC, but with the caveat that it should go through the due process through the National Council of Establishment again. So now the memo that will be sent to National Council on Establishment is what is bringing problem. And the problem is that some of the professional groups now bring about what we call discrimination at JOHESU by saying that the upward review should only affect clinically staff without non-clinical staff. And I told you under JOHESU, we have a lot of members, like the administrative officers, like the mortuary attendant, like the accountant, and so on. They are all health workers. They are employed under health. So why the discrimination? So we are challenging that, because even Section 42 under Chapter 4 of the 1999 Constitution of the Federal Republic of Nigeria states that no citizens of Nigeria should be discriminated on the ground of sex, religion, ethnicity, origin, political opinion, or occupation. And even ILO Convention, which Nigeria is a signatory, that is ILO Convention 101, talk about that discrimination in the field of, in the world of work. So obviously, we are agitating that nobody should be left behind. If the retirement age upward review will be done, it should cut across all health workers in the country.
Okay, not specific,
so not specific category of workers.
Okay.
That is 60 to 65 years for health workers and 70 to 75 years for consultant.
65 to 70.
65 to 70 for consultant.
Okay.
This is our agitation, and this is what we sign with federal government in all our MOAs and resolutions. Then the sixth one is the payment of COVID-19 outstanding allowances. Wow. You could remember during the COVID-19 how the health workers perform in this country. But it was discouraging that up to now there are some members that were not paid that allowances for their services.
Which sector, subsector are they?
No, it's not subsector. It's in some of the federal health institutions which we have compiled with their names and forwarded to the Federal Ministry of Health. So we are awaiting payment. And then the seventh one is entry point for Palm D and B farm holders. This is also something that JOHESU is agitating, which is an establishment issue. Then the eighth issue is the inauguration of Board of Federal Health Institutions. This is very important to us because of check and balances. Because since the inception of this government, there is no Board of Federal Health Institutions. So almost things are done without check and balances in federal health institutions. So definitely we are agitating on that. Although, as part of our resolutions, we agreed that the board of the health regulatory agencies will be constituted on or before the end of this month. Then the ninth one is pharmacy consultant cadre implementation. We agitated for pharmacy consultant cadre in all the federal health institutions. And there was release of a circular from the Office of the Head of Civil Service of the Federation to the MDs and CMDs through the Federal Ministry of Health for the implementation of this consultant cadre. But unfortunately, only 24 out of 73 federal health institutions that have started implementing it. So we are still agitating for the other health institutions to implement it. Then the last one is outstanding 19-month salaries of JOHESU members in environmental health regulatory agency. You could remember that sometimes last year, the Federal Executive Council stopped the funding of all the 14 regulatory health centers, health councils in the country. And this affects the salary of our members. But later, Mr. President, in his magnanimity, and Federal Executive Council decided to refund these federal regulatory councils. But unfortunately, 13 of these health regulatory councils are under the Federal Ministry of Health. But it's only environmental health that is under the Federal Ministry of Environment. So while refunding by the budget office, 13 were funded again and were captured in the budget, but only environmental was not. So that is why our members there stay there for almost 19 months now without payment of salary.
Wonderful.
So you will begin to wonder how somebody survive in this current situation without salary for 19 months.
This list that you have reeled out, I'm sure the government people are watching. I'm sure you discussed it at the meeting you had with them. Yeah. And I'm sure the government is going to attend to them. I've been speaking with the president of Medical and Health Workers Union of Nigeria, who is also the national chairman of Joint Health Sector Unions JOHESU, and Triples as the Deputy President of Nigeria Labour Congress, Ado Kabiru Minjibir. Thank you very much for sharing your time with us.
Thank you very much, Abulu.
Yes. I hope you have as well information about other health workers in the hospital apart from nurses and doctors. Meanwhile, the Nigerian government has promised to pay 7 months arrears owed to health workers. We just hope at the Tripartite that they keep to their words. Thank you for your feedback that have been coming. We appreciate them. They're helping us shape this program to give you a better package every time. Thank you for investing your time with us. Let's do this again. I am Abulu Osemahu.